good afternoon to everyone that is here today. Thank you for joining us on this timely legal session on navigating the new workplace. That is the word of the day is new because it's ever changing. With the gradual reopening of the state, we know manufacturers and businesses alike feel somewhat lost in this ever changing guidelines and policies. One agency releases guidelines one day, only to be followed by a whole new set of guidelines set out by another agency the following day. So we are officially time-stamping this session on May 7th, 2020, capturing the look of the legal landscape as it relates to employment law today in the era of COVID-19. So it's very important that we know that. We hope today's information is helpful, that it provides some guidance to you moving forward. But flexibility and vigilance, those are part of our new reality, unfortunately. And at the end of the day, as an employer, it is your responsibility to make sure that you are aware of the ever-changing laws and policies. Just a few housekeeping notes before we begin. Please hold your questions until the end of the session. We will make sure we get to those. Just enter those into the chat. We also plan to share this presentation and the recording of today's sessions with you all tomorrow, so just be sure to check your emails. I also ask that before we begin the question session, if we can ask you 5 brief polling questions that'll just populate right here in Zoom. It should take maybe 20 seconds for you to do, and that just really helps us and our team of experts just get a better understanding of where the manufacturing and business community is on this specific issue. With that, I would also like to thank our speaker, Ruth, as well as a very special and important thank you to our partner, Associated Industries of Missouri, Ray McCarty. Love his headphones on right now. Wave, Ray, thank you so much. I just want to say, when I reached out to Ray last week, I believe it was, time's flying, and said, hey, do you have someone that has this legal expert? Because we're getting these questions on a daily basis. He was so quick to respond, knew exactly where to go. So thank you, Ray, for helping us put this together. And thank you for all the work that you are doing on behalf of AIM and on behalf of our economy and moving it forward. So with that, I thank you, and I turn it over to you, Ray.
Well, thanks very much, Amy. I hope everybody can hear me okay. And I'm very grateful to be a part of this. You know, Associated Industries of Missouri is the state's oldest trade association representing employers in the state. So we have a very long history. We very much value our partnership with Missouri Enterprise. They've done a great job being a resource for small and mid-sized manufacturers across the state, and we're very proud to help promote that to whomever we come in contact with. So thanks to you for hosting it. I apologize that we weren't able to host it this time, but we're in the last 7 days of the legislative session. And so my time is extremely spread thin. Doesn't mean I'm doing anything important, just means I get called away a lot. So, you know, but we didn't want to delay getting this information out there. With Governor Parson reopening the state on Monday, I know some of the urban areas have delayed the start dates to a little further out. It's very important that employers know what to do and what they should do, especially when they have questions. So when you hit me with those questions, my very first thought was to go to the very top HR expert in the state, in my opinion, and go right to the top to Ruth Binger at Danna McKitrick. Now, Ruth has a long history with Associated Industries of Missouri. She's been a board member for a really long time, and she started in kindergarten. And she also has conducted many of our human resources seminars that we've had over the years. And so whenever I have a question from one of our members, or they are in an employment situation that needs addressing, I very often will send them to Ruth, and she gives great counsel, and all the feedback from that has always been positive. So I'm hopeful that she'll be able to answer some of the questions that have been submitted. And if you have other questions as we go through, Amy, should they type them in the chat area over there?
Yes. So at the very end, again, what we tried to do is capture all the most frequently asked questions from a business perspective. We'll have those on each slide. You will also see the corresponding link with the dedicated information or policy that is available right now. Again, time-stamped May 7th, 2020. And we'll make sure you get those slides, but we'll follow along question by question. And then if there's something that we did not get to or was not included in the presentation, simply type your question into the chat and we'll answer them accordingly.
So, with that, and I think that's very important to realize too, because I think even as recently as last night, we sent out something saying that today was a deadline for something, and then the feds changed it.
It was changed.
So it is changing by the minute. Yes, and it's changing by the minute. Along with that, I wanted you to also know that I'm going to be having to drop off here in about a half hour. I had a previous call scheduled with the University of Missouri-Rolla. We've got to jump on that. And then I've got another call right after that with the Department of Economic Development. So I don't think I'm going to be able to hop back on once I jump off. I'm going to stay in as long as I can. But those of you on the call, when you see me leave, it's not because I'm not interested, because I'm going to be watching the full recording of it probably later this evening. So thanks everybody for being here today. And I'm going to turn it over to Ruth Binger from Danna McKitrick.
Thank you, Ray, so much.
Thank you, Ray. You're wonderful. I've loved working with Ray. He's the best executive director in the whole world, and he's done a tremendous job for Associated Industries in Missouri.
Thank you.
So thank you very much for letting me be here virtually to meet you and to help facilitate what we're going to do today. So I've been given 11 questions and asked to respond to them. In the last 2 months, there have been really 3 laws that impact what employers do. And it's been hard to keep up. I can barely keep up, so I'm sure you can barely keep up either. However, in reading everything, I have divined that there's sort of an analytical framework that you can use, and which will make everything much simpler than even before the pandemic, as far as the 2 laws that come into play all the time, which is the Americans with Disabilities Act and the Family Medical and Leave Act, and then the CARES portion of Act related to unemployment. Because if you get $1 of unemployment in Missouri, you get $600 extra from the federal government. And this has made it a little tricky for employers to get employees to work. So without further ado, I'm going to start the questions. And what we've done is we have given you links after each question. It's hard to listen to everything and make sense of it. I find this like when I talk to a doctor. So the link, if you go to the link, it would be very helpful, and you can find out more information about some of the answers I'm going to give you. Also, in question 3, which I will designate when we get to it, I have given you a link to our website. Our law firm has a COVID-19 resource center, and we have about 30 articles on there, and it's everything that's related to COVID-19. Sometimes I will refer to that because we actually have an article on that particular issue. I can't cover everything, and so many of the laws have 10 different elements as to when you're covered or when you're not. So actually getting on the link will be helpful to you. So without further ado, I'll start the questions. So Amy, do you want me to read it?
Yes, please.
Okay. Can our company legally make annual flu vaccines a requirement for employees to prevent an outbreak in our work environment? And that answer is no. So the ADA, Americans with Disabilities Act, applies to employers with over 15 employees. And Missouri Human Rights Act applies to employers with over 6. So basically, most employers are covered in Missouri. It says that you can't make a disability-related question except under narrow circumstances. And those narrow circumstances are after you make a conditional offer of employment, or if there's like a due threat, a direct threat, when after the employee is hired. And they're really, the direct threat is a very high standard. So what the EEOC has done, and I've given you the link, it has pretty much overwritten that law for the pandemic. It has said the pandemic is a direct threat. So if it's a direct threat, then what it says is all of our law related to disability-related inquiries and medical exams are going to be trumped by whatever the CDC says and OSHA. So what you need to do is follow what OSHA recommends and what the CDC recommends. If you do that, you should be okay under the ADA. So this question, annual flu vaccines, that's not related to COVID-19 at all. So you go back to the old law and the answer is no, you could not require people to take annual flu vaccinations. Also, there's a religious reason too that would come into play. In our firm, we have a nurse come once a year for 4 hours and offer it to everybody. And some people take it and some people don't. We don't require an annual flu vaccination. A second question is, if a COVID-19 vaccination is available in the future, can we legally make it an employee requirement? Again, you could not do this under existing EEOC ADA law. However, it's trumped by CDC and OSHA. And if there is a vaccination, I would not be surprised that CDC is going to say it should be required in an employment sector, and you would be able to require people to use the COVID-19 vaccination because it is considered a direct threat to both yourself and to fellow employees. Okay, next question, number 2. Okay, well, this is still number 1. And if so, what do we need to know about keeping those vaccine records safe as it is health information? HIPAA doesn't apply to records kept in employment under FMLA or ADA. You're supposed to keep all your records that are confidential separate from the personnel file. So your temperature checks, your vaccination records, etc. All of that would be in a separate file and it would be protected and confidential. So HIPAA is not an issue with respect to those records unless something changes in the future. Okay, next question. I may get you this whole thing in 30 minutes, right? All right. Second question, when an employee calls in sick, what questions can you legally ask related to their illness? And can we ask them if they believe they're infected with COVID-19? You could always ask the question, why are you not here today? That was always allowed. But again, we're going back to how CDC and OSHA trumps the ADA disability-related questions. So under CDC and even EEOC, you can ask that you can go through the questions as to whether or not they have COVID-19, shortness of breath, coughs, temperature, can't smell, etc. You can go through those questions. Can we ask them if they believe they're infected with COVID-19? Yes, you can. You can send them to, there's a CDC checker, which is, I've given you the link to one of these questions as we go along. You can ask them to contact their doctor and find out from their doctor what they should do. So what I've given you is the CDC guidance for businesses. And again, back to that pandemic preparedness workplace. So if you just remember this, CDC and OSHA trump EEOC ADA disability inquiries questions, you should be great. That's it for this question. I can do follow-up later on if anyone's interested. Okay, next question. Third question. All right, this has an analytical framework because it brings into the Family First Coronavirus Response Act, the FCRA, which I'm going to call paid leave. This is a new act. It came down on March 18th. I've given you the DOL, Department of Labor FAQ website. It's very confusing. There's about 80 questions and answers, but it is helpful. I've given you an article from our website on the FCRA, which is helpful in figuring out everything. So basically, when someone says, I'm afraid to come to work, I'm afraid I'm going to get sick, you sort of have to go through 3 steps. And the first thing is, are they covered under the FCRA? Is a fear, an amorphous fear, enough to get them 80 hours of paid leave? And the answer is no. But what if they say they're depressed or they have anxiety and they have a doctor's excuse? Then that's different. They may be getting you may have to give them the 80 hours of paid leave. So you have to enter into the normal interactive dialogue that's required under the ADA, find out why they're afraid of getting sick. If the FCRA doesn't cover them, then you go to the second step and you say, okay, well, is there another disability related issue here? Do I have to accommodate them? Do I have to give them leave? If all it is fear and they're not mentioning depression or anxiety, then that doesn't apply either. And the third thing is, well, do I have any paid leave I can give them? Have they earned any leave that I can give them? If you go through all 3 and they've exhausted all their paid leave, then you can require them to work. And if they don't work, you can tell them to then terminate them on the basis of being insubordinate and refuse to work. Now, what the employee then can do is go to the Division of Unemployment and file for unemployment. Then the employee has to phrase it in a way such that the CARE Acts would apply. So maybe the employee could say, I have a family member who has COVID-19 and I have to take care of that family member. A doctor suddenly told me that I have to stay home. In those situations, you could get unemployment under Missouri law. So there's this tug of law right now because Congress really wanted to protect employees, and everybody's entrepreneurial. And sometimes, you can make more money on unemployment than you can in your job. If you offer an employee a job and they won't do it and they file for unemployment, or if they're on unemployment and now you have work available, you can put it in writing, send it to them, and then if they won't accept it, then you can file something with the Division of Unemployment. And I've given you the website for the Division of Unemployment to learn more about that. But there is this, CARES Act, unemployment goes to the end of June, so there's this tug of war now going on with employees. So again, the FCRA is there, the ADA, and then I gave you the Missouri Division of Unemployment FAQ, which would be helpful in this situation too. Okay? It's hard not to have interaction.
Okay, well, I'll jump in real quick and say that is one of the hardest questions that we're having to tackle right now, because there are people, if they're making less than $15 an hour, they can make more money staying home. And so the problem is, getting them inspired to come back to work. You have a couch mentality is what I call it, that sets in over time. The longer people stay home, the longer they get used to staying home.
It becomes the new normal. Correct.
It does. Yeah. And not having daycare expense and things like that, it becomes much more of an incentive for them to stay home. So I think that's very valuable advice that you're giving, because we really got to get them off the couch and back to work as soon as we can.
There, on our website, we list the reasons under the CARES Act that you can quit your employment and still get unemployment. If you look on the Division of Missouri's website, a Division of Unemployment, they don't tell you all the rules because they don't want to give the employees all the information just in case they're playing the system. But we do have some articles on our websites that go into this, which may be helpful for you to look at when you have this kind of naughty kind of thing where you think the employee's faking it, but you're not sure, and you're trying to figure out what direction. There's also one more layer, and it's the PPP Act, because if you got PPP, Payroll Protection Plan money, then you are supposed to keep your workforce at the same level, and you're not supposed to reduce their pay more than 25%. So you have, and if so, and you do that for the 8 weeks after getting the money, you don't have to pay it back. So it's free money. So if you can't get these people to come back to work, or you can't hire somebody else, then you have to pay back the money. So employers are really in a tight situation, and employees are using the tools they have too. So that's what makes it complicated, is this interplay between all the new rules that have come down since March 18th. Okay, next question. 4, if an employee comes to work and appears to be sick, can I make them leave? Yes. Both under CDC, OSHA, and then under ADA. Remember, they're direct threats. They could be direct threats. And you can send them home and then ask them the questions related to see if it's related to COVID-19, ask them to get on the CDC checker, have them talk to their medical doctor. What I read today, it's 100.4. Over that is a high temperature. So if they have a high temperature, they should stay home. So the issue is then paid leave. If employees don't get paid, are they going to come to work? Some employers are using the temperature scanners to test that, although the temperature scanners in of themselves do not by themselves indicate or not indicate COVID-19. But it's pretty much the only thing the employer can do, because right now antigen tests are not available and there is no vaccination, and the COVID-19 tests are not available either. The EEOC said if a COVID-19 test becomes available, the employer could do a COVID-19 test to its employees. Okay, next question. All right, through our health insurance company, we offer a health risk assessment. Can we legally require all employees to participate to encourage improved wellness? No, because that goes right back to the current ADA law, and you don't have the COVID-19 direct threat exception. this is going to ask a lot of personal questions that have nothing to do with COVID-19. You can't ask disability-related questions, so therefore the answer to this is no. So I gave you the ADA pandemic workplace site again because they talk about that. Okay, next. I was told I should slow down in my speech, and I'm trying. I actually went to therapy once, hearing person to try and slow down my speech. All right, we employ high-risk workers based on age and or health conditions who could experience severe complications should they contact COVID-19. Can we require those to stay at home? This goes again to ADA. So you can't discriminate on the basis of age, and you can't discriminate on the basis of a disability. So you can enter into an interactive dialogue with your employees and ask them how they're doing and see what they say. Our experience is if people do have an issue, they come and tell us. They say, I have diabetes, I have a heart condition, I'm worried about working, I can work from home, can I telework? If you can telework, then the employee can stay home. A lot of jobs you can't telework. So then you have to go through, if the employee feels they're high risk, won't work because of their high risk, or the doctor said that they're high risk, under the ADA, you could give them unpaid leave. If you fit under the FCRA, CCA, maybe you could give them 80 hours. But eventually, because the doctor is saying that it's a severe condition, it's going to last a while, you may be able to terminate them because they have to perform the essential functions of their job with or without accommodation. And some people can't be accommodated. 35% of the jobs can be done telework. The rest cannot. So if they're on the line, there's not that much you can do. You have to go through the framework and try, but it's possible that they can't work, but then they could file for unemployment and the CARES Act would probably cover them. All right, that, and then again, I gave you the EEOC. Okay, next question. If there's a positive case in my company, what information can I reveal about that person to my workforce to prevent in the event they're exposed? You can't reveal anything. What we see around here is you say somebody on floor 7 we think has COVID-19 or is being tested. We are sending in a disinfecting crew. We are polishing down all the surfaces. We are cleaning up all the areas, and you can't tell them who it is or that they're home. Now, the way most organizations work and social media works, probably everybody's going to know that anyway, but it can't be you who advises your employees about that. It's confidential information under the ADA, and it's their privacy. Let's see. And then, yeah, it's sort of interesting because some of these cases that I'll talk about, one of the things they're saying is, well, a couple people got it, you didn't tell everybody. Well, the employer is like in this box. If it does one thing, it violates the law here, and then the employees aren't protected there, and yeah, it's really difficult to navigate right now. Okay, let's go to the next question. Okay, at one point is the line crossed from employment at will rights of the employer when compared to rights of employees. Basically, employment at will is the doctrine if you're under 40 and you're a male and you're not covered by the ADA. Then the employer can do anything with you, right? It can terminate you because you have pink hair or blue hair. But otherwise, the federal laws come into effect, and employment at will is the law subject to the federal discrimination laws. So you could have a female in front of you, you could have a race issue, a national origin person, or an ADA issue. So really, there's a culture issue here too. You want employees to think that you're reasonable and you follow some rules. Employment at will suggests, I don't like you today, I'm in a bad mood, you're gone. So I guess, there's the legal thing about employment at will, and then there's the practical thing of keeping everybody very, very productive and working together, and creating some sort of paper trail in case you get sued, and reducing anxiety in the workplace. So I would say that employment at will employment at will works the best if you have someone in front of you with no no rights, which would be a male under 40 who doesn't have an ADA issue. Okay, next question.
Quick question, or wanted to interject here. Would you recommend then to have policies in place, whether it's you can't have blue hair here at this place of business, or you need to adhere to these certain safety protocols, bringing a mask or whatnot? Would the words of wisdom be that they need to make sure that those policies are understood by employees?
So if the policy is related to something, if it's something that people would scream about, like a mask, if the CDC says you need it at work, the place, OSHA says it, or a government organization, a government arm says it. So like I'm hearing St. Louis County is going to require a mask. So if that is true, then the employer would have to require the employee to wear a mask. Is that what you're asking me?
Yes. Yes. So if can a company essentially require that, and as long as it's in the policy and it's understood, then they can say, hey, if you don't want to play by these rules, there's the door.
Yes, because again, it's all about OSHA and CDC. A mask is considered PPP, personal protective equipment, PPE, personal protective equipment. OSHA has a three category, like first responders and hospital workers have heightened risks, so heightened protection.
Sure.
People who work in stores may need a mask because the customer and them are going to be worried. And then there's, I would say, places like us where we don't have clients coming really to the office, and we have a big enough space where we're not running into each other. So we allow employees to make their own decision. But if St. Louis County says you have to wear it, we will wear it. And then it'll be St. Louis County's fault. So it won't be an ADA issue.
Great. Okay. Thank you.
You're welcome. All right. Can employees sue their employer for not protecting them, not providing tools to protect workers, or setting up protective areas? Okay, so this is like a workers' comp OSHA. The reason workers' comp is a great thing because every part of your body has a number, and the employee
the meat chart, right? The body chart, the meat chart.
The employee can't get more than that number, so there's no punitive damages. But workers' comp does not apply if it's like super negligent, egregious on the employer's part. So there is a Walmart case in Illinois. An employee died of COVID-19. The employee is, the estate of the employee is suing, not in workers' comp, but a regular lawsuit, and asking the court for damages against Walmart because Walmart didn't sufficiently protect their dead relative. What will happen with that? I have no idea. You know that Governor Parsons has said that with healthcare workers and with first responders, you do not have to prove that you got COVID-19 at work because that is what you're doing at work, right?
Sure.
Is dealing with COVID-19 patients. So normally under workers' comp, you have to prove that there is an accident or some sort of infectious disease that you got at work that you didn't get elsewhere. That's going to be hard to prove. Maybe if you work for Smithfield and you're in a line with 50 people right next to each other, it would be easier to prove, and 400 people got it at one time, then that probably would be covered under unemployment. There was a case, I think it's against Smithfield. The employee sued Smithfield and said, this was in Western Missouri, that the employer was taking no precautions to protect them. They asked the court for injunctive relief so the court would render some sort of relief. The court dismissed it, Western District of Missouri, and said this is under OSHA, and OSHA's in charge here. We can't make more rules because there'll be different rules all over the United States, so it's up to OSHA. OSHA's, other than what's on the website, I don't expect anything more from OSHA. So OSHA and reasonable care, your duty of care is all going to be determined by what's on the OSHA website and CDC and whatever governmental agency is in charge of you, such as St. Louis County, St. Louis City. So I cite OSHA's primary jurisdiction. You're supposed to furnish employment and a place of employment free from recognized hazards likely to cause death. So, And I also gave you the article that was in Bloomberg regarding this particular meat workers virus. So can you sue the employer? Generally not under existing law, but in 2008 when we had a recession, 2009 is when a lot of law was developed. When AIDS came, HIV, there was no law on HIV. And then there was a whole, many laws on reasonable care of duty. We have a statute on AIDS in Missouri. So things will change. Do you know what I mean? This is just the beginning. I think the way employers can protect themselves is follow religiously OSHA and CDC recommendations for companies. Is that helpful? Okay, next question. Mask guidelines. Are there limitations, guidelines for best practices? We supply masks. We are not going to be a Category 3 workplace. Some of our employees absolutely want them on all the time. Some do not. We can self-distance. If this was a retail store, if this was Schnucks, I'd have masks for everyone in the plexiglass. There are some rules that say under OSHA that if you require them, the employer requires them, you have to teach people how to use them and take care of them. Whereas if you don't require them, you don't have to do that. I think, you know, like I said, I think St. Louis County is going to require them. So then it won't, given we didn't require them and OSHA did, I mean, in St. Louis County, we should be okay. We're not pushing the mask in our workforce, but the reality is some people, we want people to come to work. And if some people are scared, then it's okay for us to wear them because we want people to come to work. Is that helpful? Okay. One more question. Okay. If the spread was known to have originated at the workplace, would this be considered a workers' comp injury? And we just talked about that. You have to prove it. It's not going to be an accident, which is one of the bases for proving it. You're going to have to say it's an occupational injury. And like the Smithfield, the meat packers, I can see that as an occupational injury. I can see that with first responders and healthcare workers. I don't see that for law offices, although we've had some of our attorneys and our paralegals meeting with people who wanted to write a will. And if they don't do anything but come to work and are in a room with people who are doing their will, maybe it's possible that they could prove that it's related to our work and file a workers' comp claim against us. Okay, I've gone through all the questions.
So as far, Ruth, thank you, first and foremost. With this last question again, is again very important to document when there is a case so that, and you can show the necessary response that you took to try to contain that, to prevent further infection, so that there is a case later on. You could say, we haven't had a case for this amount. It could not have originated here. It was over months ago. I mean, what is your guidance as far as just, again, documentation for your business?
I would start, Stanford Law has all these wonderful memos on it. And they're free. They were written by big law firms. There is a return to work plans there, which I think are excellent. And they go through all the things the employer should think about and bringing people back to work and operating the workforce and the reason. I would find those and I would look at those. So I'd have the policies in place first. And then I would have somebody appointed to just be the person that handles all communications with someone who has COVID-19 or has issues or is staying home, and make sure they call the person, work with the person, don't let the person come back, handle the communications. And then that whatever records I keep would be in a separate file. And I think that's about all you can do to protect yourself as an employer.
It sounded like, again, kind of your overarching theme is as it relates to what should an employer do if they perceive someone to be ill or sick, regardless if it's COVID or flu, they need to go home. They have a fever or whatnot, they should leave work.
Yes, and I think the EOs, I think all of the agencies say that, and to figure out what's going on and to talk to their doctor. I mean, sometimes people go home and then after a day they're fine and their doctor says come back to work. Some doctors say self-quarantine. And if the doctor says self-quarantine, then the FCRA comes into effect and they get 80 hours of paid leave. And so, I mean, you just have to think it through. But the reality of it is, I think the reason why they gave that 80 hours of emergency leave is because they wanted employers to send employees home.
Sure.
They didn't want the employers. And remember, the employers actually get a tax benefit from that. And they don't pay the employer's portion of the
Payroll.
Yes. So there is a benefit to that, and they're going to get it back. So, I mean, it was a push-pull kind of thing.
Sure.
I mean, there were some parts of the law that were very well thought through. Are there any other questions?
So I'm going to leave this up here again, and for those of you that are on, you will receive a copy of this. At this time, before we open it up to questions, I did want to go ahead and start this poll, if I can get that going. Here's the poll questions that will appear, and I'm going to go ahead and start that, kick it off, launch the poll. Did you find this information helpful? I know I did. I was jotting down notes. I don't know about you all, but I plan to include some of the notes that I've taken so that you'll have my takeaway as well as, again, this presentation. But did you find it helpful? Do you feel more prepared now to handle employment situations as it relates to COVID-19? Thank you again for those that are answering. We really appreciate it. Do you currently have an infectious disease plan? I know Ruth has mentioned that over and over again as kind of that backup. You could do this or you should do that. But again, have this in a tangible plan as well as communicate it to your staff what that plan is. You can have a plan all day long, but if it's sitting on a shelf and no one knows what it is, it's not very useful. Having a dedicated individual there to handle these cases or questions is important. Next thing we have is your company now fully operational, and that's just, are you running your business? Are you partially running it? Are you employing all the individuals that you previously had before COVID-19? Again, this just helps us all as a community understand where our business community is relating to moving through this crisis. And then this is a selfish plug again, of course. Wanted to make sure or see if you've ever heard of Missouri Enterprise. A little bit about us. We are the dedicated Manufacturing Extension Partnership, MEP, Center for the State of Missouri. There's one of us in every state plus Puerto Rico. We're part of NIST MEP as well as partnership with the state of Missouri. And again, our team of experts are dedicated to supporting and sustaining Missouri's manufacturing industry. We want to make sure that we can weather through this storm together. Manufacturing is one of our top industries, and we want to make sure that that stays that way. So following this session, we'll just go over a few different assets that we have right now. If your head is just exploding thinking, we don't know what steps to take next, this is all helpful, but now can we just have Ruth come in and write all of our policies? I'm sure, Ruth, you have a lot of other things to do as well, but again, you are there for legal guidance. But we do have folks on staff that can help you navigate those guidelines and develop that plan. Okay, looks like we had quite a few of you take it. I'm going to give you 20 more seconds. And Pamela, I see you raised your hand, so I'll get to you in just a second. Okay, and I'm going to close down the poll. Thank you so much. We really appreciate your input. I'm going to close that. Okay, so again, going back to our dedicated team of experts, these are just a few faces that are on our team that have lots of experience in healthcare and or manufacturing, from business continuity planning, resiliency planning. You know, we know that this is not going to be the last time that we see COVID-19. It's just a matter of when that wave comes back. So it's one thing to recover, the next is to prepare for that. So that's where we have leaders and experts like Tom Gordon. April Schmidt, again, a wealth of healthcare knowledge that she brings to the table that can help with setting up safe practices, infectious disease planning, wellness hygiene policies, returning to work preparedness. And thank you, Ruth, that I'm going to make sure that we include that link to Stanford. We try to provide as many services that we can, absolutely free to the public, that we can. Dave Goebel, again, our supplier scout. So if there's a disruption in your supply chain as a result of COVID-19, we are here to hopefully connect you with another domestic resource for those materials. Dave is your person. And what's great about being part of this national network is that if we don't have anyone local, we're going to try local first and try to find a company in Missouri. But we can easily call our partners in any other state to ask if they have a source for those materials or products or services for you, which is, again, a great asset to have. Next slide here. Okay. Secondly, I wanted to just talk to you briefly about our COVID-19 readiness recovery assessment. This is, I think, about 34 questions. It's online. You can take it anytime. It's absolutely, again, free tool that you get to take and walk away with. And it really kind of pinpoints your weaknesses and strengths as it relates to overcoming and working through this pandemic. Again, I imagine there's a lot of folks out there that do not have an infectious disease plan. They haven't started it, or maybe they have one. It's a little dusty and they haven't communicated it. So this assessment just really helps identify some of those areas where you can work through, or we can help walk you through them. I encourage you all to take that. It's a great first step to really figure out what, if you do need help or assistance or resources, this will kind of serve as your roadmap. We have a new product or a new site that's coming out, we're hoping tomorrow, cross our fingers. I know you guys have all seen the solicitations to provide PPEs for the medical community, because it was such a huge, significant demand to protect our medical staff, our first responders, those that have tested positive for COVID-19. How do we protect the folks working with them? And so we've all, as a country and nation, come together to ask our manufacturers to, hey, can you stop making this? And can you help make these PPEs? And it's just been an incredible response from our manufacturers. We are entrepreneurs. A lot of the products that we made for a reason. We made for a need, and we found a need and we're filling it. So there's a lot of manufacturers out there, though, that are making possibly non-medical grade PPEs, maybe for their families or a business in their community. We want to make sure that we have a platform for you to post your products and services to help other Missourians and other companies reopen. I know we were talking about PPEs, gloves, cleaning products, protective barriers. So these are, again, products and services that can help our companies, our business community in Missouri continue to reopen and make sure that we keep our employees safe. So if that's something you're interested in, actually featuring your product, this is a self-sustaining site. I would not be able to manage it myself if I had to vet these products. So please know there will be a disclaimer. We are not approving these. We're not vetting them. This is simply a free site for companies to say, hey, we can provide cleaning products. We are making these masks and we can sell them to companies or members in the community out there that are looking for products to protect their families or their employees. So that's coming, again, as I stated, hopefully tomorrow, and I'll make sure to keep you all posted.
Great.
So that's all we have for today, other than I'm going to kick it over now, and I'm going to stop sharing my screen, and then let's go ahead and answer some of those questions. How about that?
Okay.
Okay. I'm going to open up our chat right now. So we have Rachel Hankerson, who's been a rock star. She's been very engaged. She's a manufacturer in Missouri, comes to all of our events. So thank you, Rachel. Oh, and it looks like she's back on now. She was knocked off, so that wasn't a question. Okay, so Andy Button says, if you have a camera system and an alarm goes off because someone's temperature is elevated during the screening process, is that against HIPAA law?
Oh, because everybody knows that the alarm went off.
That was you. Everyone knows. It's basically identifying who it is, I guess, at that point.
I think once it happens, perhaps you could find another thermometer that doesn't do that, or you take the person into another room. A first time happening, as long as it's not a pattern, I don't see that as a violation.
Because it's not, again, great negligence, correct? It's not.
You're accommodating. You figured it out. You changed it. Yeah.
Great. Okay. Are there any potential liabilities or liability risks for building owners in the event of an outbreak at a building? What actions could be considered due diligence to protect itself? Great question.
Yeah, I'm thinking of our building. We right now, we're in a 14-story building, so only 3 people can be on the elevator. Everything is disinfected. All the areas that are high touch are disinfected a couple times a day. Somebody on the 12th floor had it. We were told about that, and we were told that a crew was coming in specially to fix that, because real estate owners can be sued along with the employers, right? Because it depends on what the lease says is who's responsible for upkeep, common maintenance. So if you own the building but you rent it to other people, then the common areas you're responsible for. And that would be the same thing that's on the CDC, is disinfecting. How do you get all those people up to the 12th or 14th floor? You may want to shut your cafeteria if you have a cafeteria. You know, I have seen, you know, where every 6 feet there's like a little circle so people can slowly come in, just like they do now at Schnucks. You have to think through how many people come into your building and out and what you're going to do about it. But I think if you look at CDC, you look at what other people are doing, and then you publicize it, I think you will have met your reasonable care, your duty of reasonable care, and it'd be hard to prove that that person got COVID-19 in your elevator, right?
Sure. As opposed to at the grocery store. Or
yeah, I think the grocery
else.
store is one of the most dangerous places I go to.
And I've heard gas stations, the same thing.
That makes sense.
Putting fuel in your car.
Yeah.
And that's, I wonder, you know, do these same rules apply to places of public accommodations? So would that be something similar, correct?
Yeah, yeah, because you're inviting people, you own the real estate and you're inviting people in. So yes, you would have the same. It's going to be hard to prove where you got COVID-19. It's a 2 to 14-day incubation period. You know, if all you did is go to work and come home and you worked in a meatpacking plant, that's going to be a lot easier than, you know, what you did in your free time and you went on an elevator or somebody sneezed down the street. It's just going to be hard to prove that.
Sure.
Again, the Republican leaders are trying to get protections for employers and businesses so that they don't have liability when they open up. I don't know how that's doing today.
Sure, Ray, if he were here, he would possibly have some insight on that. I know that, again, that is a moving target. So that's the way it will be, I imagine, at this time. Next question we have is, if one of your employees tests positive, do their coworkers need to quarantine?
And
that, I know that's more so
well,
dedicated to maybe
if they feel sick, right?
Yes.
And it depends what kind of interactions the employee had with the other ones. Like I know of one where the guy had a friend who was a pilot, and that's probably where he got it. So he went to work, but he had a meeting, but there were 2 people in the office and they were spread far apart. So he went home and with respect to this person, and there was another person, they stayed home for 5 days and they didn't get it. They talked to the doctor. The doctor said they could come back to work. I would always have the doctor, the medical care provider, make the decision.
Great.
That'd be the safest.
Thank you. As we enter allergy season, how do we decipher between symptoms that are in alignment with pollen versus COVID-19? My question can be answered after the presentation. Okay.
It's terrible. I mean, every time I sneeze, I think I have COVID-19.
I was coughing by one of the answers, and I had to mute because I'm like, oh no, I hope people don't have it here. So, yeah, it's a natural reaction to it.
Yeah, I've been walking 3 to 5 miles a day, and it's the most beautiful spring that I can remember, and it's the longest spring,
yes.
And there's like this much stuff on my car from all the stuff that's coming down. So yeah, it's sometimes I go to bed thinking I have it, I know I have it,
mm-hmm.
And it's allergies. So it's scary. One of the things is I never had a fever, I may have coughed and sneezed a bit, and then a lot of phlegm. So, I mean, there's some things that you can figure out yourself, right? Without scaring your total workplace.
Yes, yes. And again, you know, some of this would be a good question for a physician to have.
Yeah.
But again, when in doubt, the rule is if someone seems sick or ill, they should stay home. Mm-hmm.
And it's pretty easy to get with the tele doctors now, you know,
Yes.
it seems like it's pretty easy to get an appointment.
Yes.
So.
Okay, we have another question. Is there a good definition of quote unquote close contact as it relates to whether you should quarantine after a coworker gets infected? So is there a legal definition of close contact? Are those perimeters in place?
CDC
is it within 6 feet?
6 feet.
Okay.
CDC says 6 feet. Again, they established the reasonable duty of care, so I go with CDC. We actually have, like, our receptionist has spots. She's measured out 6 feet all around her so that people are very aware where 6 feet is. Apparently, they're actually coming up with wristwatches that will tell you when someone violates 6 feet. So
wow.
Inventors are totally getting into this with
technology.
Yes, yes.
Great. Hey, any other questions we have? I know we had someone raise their hand at one point. I don't know, Ruth, if you're seeing anything yet come in.
I have like a question and answer. Should I be sitting this? Okay. We talked about that test pod.
There's one at 222 from Julie. Which resources do you suggest to check each day for new changes in policy affecting Missouri manufacturers? Great question.
You know, I have to give a lot of credit to Brenda Marla, our marketing director. We have kept on our COVID-19 resource center. We have all these, almost all the counties and the states stay-at-home orders. So you could check our website. We try to keep up. I would check CDC and OSHA. OSHA's not going to change that much. OSHA's pretty much made it plain that they're not going to create any more new rules. So it's going to be the CDC that's going to change. Like now they say that there are more symptoms like losing your sense of smell or taste, that is a symptom of COVID-19, having purple toes or something like that. That's, you know, they updated that to change that. But that's what I would do. And, you know, be aware what, if there's a Department of Health in your county and what your county or city is saying, and read the county. Like St. Louis County governs what we're doing here.
I'm just trying to, again, put my mind around if I were, for instance, a manufacturer and I was shipping product and I had my employee go from point A to B and they were driving across counties where there were different guidelines in place. And perhaps my employee contacted the virus, came back. That sounds like a big mess, but a very, you know, it could be a reality at one point to manufacturers who are shipping their products. Any guidance there as far as jurisdictional with county versus county or state versus state?
So basically manufacturers, most of my manufacturers are an essential business based on a government regulation. So they can continue to operate and their employees can continue to go across jurisdictions that have stay-at-home orders. So it's almost like, you know, if I was a truck driver and I had to go to Chicago, and when you compare Chicago's fatalities and virus counts compared to St. Louis, they're pretty high. But how, again, you know, other than wearing a face mask and wearing gloves, protecting your employee that way, how do you prove that where the employee got it? So I drove up to Chicago twice, 2 Sundays in a row, to do some real estate, handle some real estate issues. And there was nobody on the road, for whatever that's worth, going up to Chicago. But, you know, Chicago's supposed to come in line again Missouri's going online, St. Louis County and City are going online, I guess on May 18th. The rules may change based on whether or not we get a second wave, right? And there may be more information coming out of the CDC. Again, this is time-stamped.
Correct. And of all of the authorities out there, you are, from what you're seeing, is that CDC really is the kind of hierarchy there, the dominant authority as far as what trumps what policies. Is that correct?
Yes, it's not, because the employment laws have always bowed to medical authority. And the Center for Disease Control is the medical authority, and OSHA. So if you're going to go to court, you can't do it on protect yourself on a tweet. You have to protect yourself on something that was on the CDC website. Is that what you're asking me?
Yes.
You
yes.
would have to. Yes. In medical, it's all. I mean, employment laws have always held medical authority high regard. Lawyers don't know anything. Doctors know everything. So it's doctors, CDC, and OSHA.
The rest of us are just trying to figure it all out.
Yeah, and navigate all those laws and come out into something doable.
Yes. Well, I think this is a good time. We haven't seen any other questions come in. Ruth, I want to thank you for taking the time. I know you're extremely busy right now with your schedule, just trying to, again, navigate this for yourself and your clients. Thank you for shedding some light on this topic. We really appreciate your passion and dedication to educating us as a community, offering your time to help our business and manufacturing community. Again, Ruth's contact information is in the presentation I plan to provide you. I will again make sure that you all see a recording of this session. Ruth, I'll make sure you're on the email as well so you can have it. And we really want to thank our partners at AIM for helping make this happen. So be safe out there. Please continue to check our website, MissouriEnterprise.org. And again, Ruth's website with her law firm. And thank you. Have a great day. And hopefully, if this comes back and we have additional questions, Ruth, I hope that you would be open to chatting again in the future on this.
Sure.
Sounds like this is not the end.
I'm sure I'll have new information.
That's right. And I thank you for showing us that resource on your site. We'll make sure we point to that.
Okay. Take care.
Happy Thursday. Thank you, Ruth. Thank you to everyone.